Hello everyone, welcome to my channel, and in today's video we are going to discuss pulmonology referrals. So this is another video in my referral series where I discuss immediate and urgent referrals under each subspecialty because these conditions are potentially life-threatening and you need to pick up this condition in the exam and refer them immediately or urgently in order to demonstrate that you are a safe doctor. Okay. So first of all, let's discuss immediate referrals. These are the patients who need to be seen immediately in the accident and emergency department. So the first one that we have here is acute severe asthma. Okay, so a known asthmatic patient is calling to the GP surgery or is physically coming in and complaining that he or she is experiencing acute shortness of breath, which is not responding to their usual inhaler medications. They are not able to speak in full sentences, or there are signs of severe hypoxia like cyanosis. You need to refer them immediately to the accident and emergency department. Okay. Then any acute COPD exacerbation. So a known COPD patient who is now presenting with sudden worsening of his or her symptoms, like sudden extreme shortness of breath and severe cough, and the patient may be confused because of hypoxia. Okay. Then any case of suspected pulmonary embolism need to be immediately referred to the hospital. And these patients will undergo CTPA for the confirmation of diagnosis and then will be admitted and started on either IV unfractionated heparin or subcutaneous heparin. Okay. Any case of severe pneumonia presenting with high-grade fever, increased respiratory rate, low blood pressure, or sign and symptoms of hypoxia like confusion, you need to refer them immediately to the hospital. Okay. So severe pneumonia also need to be immediately referred to the hospital because they may have oxygen requirement. Okay. And they might need IV antibiotics. All right. So now in infants, we have a condition called severe bronchiolitis. These infants present with shortness of breath manifested by increased work of breathing. So they are using their accessory muscles of respiration. They are feeding poorly. They are lethargic and cyanosed. Okay. So you need to refer them immediately to the hospital for because they need oxygen and may need IV fluids as well because they are feeding poorly. So severe bronchiolitis also need immediate referral to the accident and emergency department. Then any massive hemoptysis because of any underlying cause, but more frequently massive hemoptysis can occur in cases of bronchogenic carcinoma or bronchiectasis. So any massive hemoptysis need to be referred immediately to the accident and emergency department. So that was all about immediate referral. Now, urgent referrals where 2 week wait pathway are usually suspected cancers. So if you're suspected lung cancers evident by persistent cough lasting for more than 3 weeks, history of smoking, false symptom positive. False is basically an acronym which stands for fever, appetite loss, weight loss, lumps and bumps, and night sweats. These symptoms are journal symptoms pointing towards a diagnosis of underlying malignancy. Okay, so if false symptoms are positive, if there is an unexplained hemoptysis going on, or if there is an unexplained mass on chest X-ray, you need to refer them for a 2 week wait pathway to respiratory medicine for CT scan. And if a mass is there, then biopsy and histopathology of the mass for diagnosis of cancer. Okay. Then any unexplained pleural effusion, any unexplained persistent pleural effusion can also point out toward the diagnosis of underlying malignancy. So if there is any unexplained pleural effusion, then these patients also need to be referred by the suspected cancer pathway. So that was all about pulmonology referrals. I hope it was helpful, and I will see you soon in the next video.